Welcome to our patient information video on asthma. In this video, we'll be covering what is asthma? What are the causes? How is it diagnosed? We'll cover the progression of the condition, highlight any symptoms, treatment options, long-term management, as well as provide other useful resources for more information. Okay, so let's get started. Asthma is a common long-term lung condition that affects the airways. In asthma, these airways become sensitive, swollen and narrowed, making it harder to breathe at times. It can begin in childhood or develop later on. For most people, it can be controlled with proper treatment, but severe symptoms or sudden attacks can be life-threatening if not managed appropriately. The exact cause of asthma isn't fully known, but it's linked to a mix of genetic and environmental factors. Family history, allergies, and exposure to triggers like pollen, dust mites, cold air, or air pollution can all play a role. Some people may also develop asthma after a respiratory infection or as adults. Certain factors like smoking or exposure to secondhand smoke increase the risk of symptoms and attacks. Here you can see the difference between a normal airway and one affected by asthma. In a healthy airway, the muscles are relaxed and the passage is open, allowing air to flow freely. With asthma, the lining becomes inflamed, the muscles tighten, and extra mucus can build up, narrowing the airway and making breathing more difficult. Your GP or nurse will usually diagnose asthma based on your symptoms and simple breathing tests. They may ask about wheezing, coughing, or breathlessness and how they vary over time. A common test is spirometry, which measures how much air you can breathe out and how fast. Sometimes asthma is diagnosed by how your symptoms respond to treatment, especially if tests aren't conclusive. If untreated or poorly controlled, asthma symptoms can become more frequent and severe. You may experience ongoing breathlessness, persistent coughing, disturbed sleep, and reduced ability to take part in everyday activities. There is also a higher risk of severe asthma attacks, which may require hospital care. Keeping asthma under control with appropriate treatment greatly lowers the risk of flare-ups and long-term complications. Common asthma symptoms include wheezing, coughing, shortness of breath, and a tight chest feeling. These may come and go and are often worse at night or in early morning. Some people notice symptoms only with exercise or cold air. A severe asthma attack can make it difficult to speak or walk and needs urgent medical attention. Asthma is mainly treated with inhalers. These deliver medicine directly to the airways to reduce inflammation or open them up so breathing is easier. Common preventer inhalers reduce swelling over time, while reliever inhalers act quickly for sudden symptoms. Your healthcare team may adjust treatment if symptoms persist. In some cases, additional tablets or newer biologic medicines are used. Managing asthma long-term means taking your medicines as prescribed, avoiding known triggers, and monitoring symptoms. Regular reviews with your GP help keep treatment right for you. An asthma action plan sets out what to do when symptoms change. With the right plan and support, most people keep asthma well controlled and enjoy normal lives. So in summary, asthma is a common, manageable, long-term condition of the airways. With the right diagnosis, treatment, and planning, symptoms can be kept under control and most people lead full lives. If you notice breathing problems, persistent coughs, or worsening symptoms, speak to your GP. Early diagnosis and good self-care save lives. For more information about asthma, visit the NHS website for a clear medical overview covering symptoms, diagnosis, and treatment options. You can also explore Asthma and Lung UK for practical advice on living well with asthma, including self-management tips and inhaler guidance. For insight into how asthma care is improving across the health service, NHS England provides information on clinical reviews and advances in treatment. Thank you for watching our patient information video on asthma. We hope you found it useful.